So the prostate is located immediately underneath the bladder, and actually the urine comes through the middle of the prostate gland. The actual function of the prostate gland is to produce the fluid part of ejaculation, so it's actually a sexual organ. Unfortunately, with age it tends to get larger and larger, and as it does, the central part closes off, and men struggle more and more with their urination. The PSA, or prostate-specific antigen, is a small glycoprotein actually made by the prostate gland, and it helps prevent the agglutination of semen. So it actually helps keep the semen alive, keep it healthy, and stop it from clagging together. A little bit of that from cells actually goes into the bloodstream, and it comes as a measurement, a level, and then we use it as a guide in context with the patient to determine if it's significant and if it requires further investigation.
It's always on my mind, even when little things with me like, am I going to the toilet too often? Is that a problem? Should I go and see someone? And you're never quite sure. So I'm a once-a-year visitor for this sort of thing, just to make sure.
See it as a health checkup every 12 months. You get your cholesterol checked, you get your sugar, your blood pressure, your weight. It's just part of your health checkup. You're maintaining your body. Your body is a machine, basically. Getting a test done every 12 months, you can see what's going on. You and your GP can keep an eye on it. It goes up and down, up and down. And if it starts to rise, it's an indicator there is something wrong. But it doesn't mean you've got prostate cancer. You may just have a bigger prostate, which is putting out more PSA. You may just have an infection, which needs to be dealt with. But if you get it on top of it early, you've got more options. And if it happens to be prostate cancer and it happens to be low risk, you've got more options. You can do active surveillance, or you can have treatment, of course. The beauty of active surveillance is you're putting off dealing with those side effects. But often I say to blokes, this is a tap on your shoulder, you need to start looking after your health. And if and when you need treatment, you're in a better space mentally and physically to deal with the side effects. And the other thing, if you were married with a partner, is talking to her and your family, so you are sharing the problem. And as I often say, it's actually a couple's disease, because the impact on the relationship and your partners is just as important, when in fact research shows the partner or the wife is impacted even more so, because they think they're going to lose their man to cancer.